first day on your first job as a nurse, and how was it?
Oh, wow. Oh, I didn't know that was one of the questions. Absolutely terrifying.
All right, it was horrendous. I cried my whole first week of orientation.
What I remember most about my first day is that I felt like an imposter.
Well, I remember thinking I didn't know anything. It was terrifying, like anything else. You're not used to having the responsibility of all those patients and being on your own and wondering who you go to even try to get the help, especially when you're short-staffed.
I remember thinking to myself, I can do this job and I'm really going to like this job. Little did I know what was to come down.
I can say that I was very nervous.
My first day, I remember orientation, and orientation, there wasn't a lot of stress involved at that point in time because I was following a nurse.
But I did share with my mentor how scared I was the night before, and I said, I really don't know. I don't know how to be a nurse. I know the answers. I scored well on the tests, but I don't know how to be a nurse. So what do I do? Oh my God, what do I do? And she said, that's completely normal, and that is what you're supposed to be feeling, and you will have so many different people and resources to go to. Just don't fake it. If you don't know it, ask for help, and don't fake it, and be yourself. And she said, and have fun. This is what you wanted to do.
So I wasn't even taking care of patients, and I was already crying because I didn't know I could handle all of the things that they were telling me I was required to do.
And I remember that as I walked down the hallway and cared for my patients, the realization that suddenly I am truly responsible for these patients and no one else was coming behind me and checking up on me, making sure I was making the right decisions. I thought that someone was going to come up and say, I'm sorry, we made a mistake. And you are not supposed to be a nurse, and we rechecked your scores, and you are not supposed to be here. Can you please come with us?
But this is a really good thing, because I think if you come off too cocky, not only do you not make friends, but you could get yourself into a lot of trouble.
So I went home every day and cried, and I thought I was never going to go back into the unit. The first day on orientation on the floor, I cried. I hadn't even been taking care of patients. So now when they actually put me to take care of patients, I didn't cry because I didn't have the time to cry. It was really tough. It was in a med-surg unit. Sometimes on night shift I would have up to 14 patients. So it was it was challenging, but it made me a better nurse.
Started off on a floor, on a very large orthopedic floor at Ford County Hospital. It was very interesting, and at that time had a very strong head nurse that believed in team nursing. So that was very comforting to have a team to work together to meet the patient's needs. So,
My first day on the job was very overwhelming, but I survived. However, I was working in an office, and one of the patients I had seen actually came back to be seen because they started having difficulty breathing. So I thought I had done something wrong, but I was informed by the physician I was working with that I had not. It was just a situation where kids got bad, and they got bad quick, and this little guy did. So it was a little overwhelming at first because I thought that I had messed up, but it was also allowed me to be cautious because it reminded me that things change very quickly in nursing, and to be prepared for the next thing and be ready to respond to them quickly.
Didn't know whether to go left, right, back and forth, who to see first, what to see second. So I don't think I'll ever forget walking on that floor and feeling the impact of the capacity at which I was placed.
I wasn't feeling quite as comfortable my first day alone because all of a sudden now the responsibility was on me. I can remember feeling high-strung. I don't think I ever took a break that day, and I think all I did was go to patient room and make sure that they were okay and double interval to check myself. I can remember maybe a few weeks down the line actually deciding it was okay to get a drink in 12 hours or to go for lunch.
One of my first hospital days in med-surg, I had a nurse that I was working with, and when I got report,
her ending comment to me was, if I don't know the answer, if you have a question, ask me. If I don't know the answer, I'll find somebody that knows the answer. And I said to myself, she's the nurse. She knows everything. What is she talking about? And then when I got to where I was graduating, I thought, now I know what that nurse was talking about because I was there. So I knew that it took time to learn.
My first day was actually very good because I went through an internship at Bayfront Medical Center for Labor and Delivery. So it was actually all classroom. It was kind of like being in school. I was really eager to get on the floor. But then when I got on the floor, it was very nice because I was partnered with a seasoned nurse, and so we worked one-on-one together all day.
And later I read an article about a syndrome that's actually called imposter syndrome. And it's where you feel that you are not qualified to do what you're supposed to do. Because all you remember, you're flooded with the thoughts of all the things that you don't know. And you remember all the things that you didn't get a chance to do in nursing school. You think, oh, but I never got to do this skill, or I never got to see this, or I never got to see that. And what you forget is all the stuff you do know. And that's the stuff you have to remind yourself of is, wow, there's a lot I do know. And but unfortunately, the human nature is to remind yourself of your insecurities. And so I really felt like I had imposter syndrome, that I was just faking it. And someone was going to figure me out, that I really was clueless, and I had no idea what I was doing. But I still kept smiling.
You're not going to quit on day one because you will know that you can get through it. That was 17 years ago, and I'm still doing it. So it was just, as the mentality of a brand new baby nurse, it was like, what is this? This is way too much. And surprisingly, you are able to handle it for the most part. There's going to be days, which I think is your next question.
So, when you were afraid or overwhelmed, what did you do to calm yourself?
Well, I was already teaching Lamaze classes at the time, which was a big benefit, so I just did my own Lamaze breathing, the deep breathing and focal point, try to take myself away from the emotion and think logically. Sometimes that's really much easier done. Much easier said than done, but it's very beneficial to just do some deep breathing and take yourself out of that situation for a few minutes and gather your thoughts.
I think my hardest job was working in open heart. And there would be times that I would be driving to work and I would actually be getting nervous inside because I would be thinking about the acuity of the patients, or if I had been there the night before, I was concerned with what kind of condition they were still in. So I used to just think to myself and try to center myself and say, okay, please don't let me hurt anybody, please let me stay focused, especially when you're dealing with so many medications and the titration of medication drips.
I don't know that I always calmed myself down very well, to be honest. I'm a perfectionist at heart, and I want everything to be perfect and right, and so sometimes I'm harder on myself than others would be. I can tell you what people told me over time, some lessons learned that they saw in me. One lesson learned was one of my charge nurses who I adored. She said to me, I can always tell how your day is by watching you walk down the hall and seeing how fast your ponytail swishes. The faster it goes, the more stressed you are, and I know that I need to check in on you and say, do you need any help with anything? So that's what she would tell me. She said, I always watch to see how fast you're walking and how fast your ponytail is going back and forth. And then probably one of my biggest learns that took me probably almost a year to learn and to get comfortable with was the fact that in nursing it's not all black and white. There is a lot of gray. And because I like everything right and wrong, I like algorithms, I want to know what's right, and I'm going to do everything within my power to do what is right. Gray was hard for me to see gray and to learn to embrace gray. And that same charge nurse actually, I don't even remember the exact situation of what it was with the baby, but we said something, I did it, and she said, Shannon. I said, what? And she said, you just saw gray for the first time. I can't believe it. It was a big deal because I probably drove people crazy with wanting to know the exact right answer, and there's not always a perfect exact right answer. It's situational, and there's gray, and you have to learn to embrace the gray.
When you were afraid or overwhelmed, what did you do to calm yourself?
I cried. I went to the back room and I had a good cry, and I wiped my tears, And I went back because I was there to take care of the patient. That should be your number one priority. Sometimes you just need those emotions. You need the emotions to come out so you can clear your mind and go in. I think that when I get overwhelmed, and that's even to this day, even teaching, sometimes you are overwhelmed and you need to either a good cry or just find someone that you can express and tell them this is what's going on. One thing in nursing is we are a team, so if you are overwhelmed, sometimes you just need someone to talk to you, and maybe someone else's perspective will definitely help. Your co-workers, an old instructor, a friend, just someone to say, this is what's going on, I feel really overwhelmed, what should I do? For me, crying does work. So that's just me.
Breathe. Like I tell you all to breathe when you're ready to take a test. Just try to breathe. Watch how you breathe. Slow down. Get a hold of yourself and find someone that will help you.
Well, when I was afraid or overwhelmed, to calm myself, I would always know that I had resources there. And I was very fortunate because I worked at a level 3 high-risk hospital, so there was always someone there with more experience, and it was a wonderful group that I worked with there to help. And within time, I was one of those nurses that could help, and we always had internships and going and teaching new nurses and new physicians how to do things. So it was a great group of people.
That does happen, especially in the beginning. You have to make decisions, you have to make them fast. And I think what's hard about nursing is when you're making decisions, it's in front of people. And you're making decisions in front of that patient who's looking at you for advice. You're doing it. It's even harder when it's in front of their 5 family and friends that are staring at you. When I got overwhelmed, I first wanted to step out of the patient's room and find a little place to myself, and I just needed a little time to reflect, and I needed a time to pray, and I just needed to sit and just remember that I wasn't alone, and that I was there to help people, and I was there for a reason, and I was dedicated, and that I loved my patients, and I loved what I was doing, and I was there for a reason, and I wanted to make a difference in their lives, and that I just wanted to do the best I could, and then if I needed help, I ran and got help. And you always have to find your mentor, and you will have a mentor. There will be someone that you will trust, and you seek that person out if you ever have any question. And you go and you talk to them about your situation, and you get guidance. So it's so important that you have that person that you can go to and talk with and get guidance whenever you need it, and you never hesitate to go and ask.
I can't come up with a specific technique. I will tell you that I always maintained my professionalism and tried to keep acting like I knew what I was doing. I just kept my confidence level up. So I guess the technique would be to fool everyone into thinking that you did know what you were doing, and then go seek out someone to help me figure out how to settle down or how to manage the situation.
Deep breath, sometimes removing yourself from the situation if you can, but investing in someone that takes time to invest in you is important. A mentor is really helpful to know that someone else has been there, to know that someone else has experienced what you're experiencing, kind of helps you with those uncertainties. I think it's a really big help. And then I'll run. That's my biggest relief.
What was the coolest thing you've ever seen or ever done?
The coolest thing, unfortunately, it's somebody else's misfortune, but is in open chest code. When you get the opportunity to actually see somebody's heart striving to or trying so much to pump and to put the patient in a better position, when you actually get to visualize the internal cavity. There's nothing like that in AP.
Oh gosh, so many. One thing that stands out is I had a patient who presented at 28 weeks, and she was in a car accident in VA, and the baby was having late decelerations. You all should know what those those are not good. And we had to go to do a stat C-section. And when we got in there, you're always wondering if you're making the right call because it is a 12-week early baby and you're delivering a preemie. And should you wait? But it was so bad that the imprint of the steering wheel was bruised on her uterus inside. So it was really quite impressive that we had all worked together and made a good decision to proceed. Otherwise, she would have probably lost the babies.
There was a couple of really cool things that I saw, particularly as a ER nurse, and I was an ER nurse down in Miami, and one day they called me out to the lobby to check a couple of patients out, and the one came in and he had a towel wrapped around his hand, and they said he needs to be seen right away. I said, well, why does he need to be seen? And as a nurse, you need to be assessing everything. You cannot be taking anyone's word for anything. So the big issue is that you need to assess, right? First part of nursing process. So I needed to assess. I says, how did this happen? They said I was fishing. I says, okay, I got a fish hook in. And fish hooks are very painful because they have the barb that goes through. So I said, well, I'm going to need to take a look at your wound. So as he uncovered it, I knew that it was in the web of the hand because he told me that. But what I wasn't expecting, the fish this big, still alive, wiggling around, because then I jumped around 10 feet. Because then they had to cut the fish off. And then right after that, another patient had walked up straight to me and says, I need to be seen right away. And I said, okay, why? And they said, because I got a really bad headache. My head hurts really bad. And their color was good. They were walking, they were talking. I said, okay, let me come back. So if you just go ahead and have a seat right over there, I'll be right back with you. And when he turned around, there was a knife sticking out of his head. So it's always good to assess your patients and just don't take their word for it. So those were two right in that one day that taught me the lesson of assess and look at everything. Find out where the pain is at. Just don't say, well, it's in the back. You may find a bullet wound. You never know that, or a knife sticking out.
What was the coolest thing you have ever seen or done?
Oh, are you kidding me? I've been a trauma nurse
I know,
for 18
exactly.
years.
What?
I think probably seeing a patient impaled with a large piece of farm equipment and being flown in from a rural hospital. The first rural trauma that I ever took care of in a level 1 trauma center was probably the best. And it was impaled up through his shoulder so that it looked like his elbow was attached to his shoulder. It displaced his arm that much, and it was probably about a 3-foot rod, which maybe a 4-inch diameter around, impaled through the guy's shoulder. And he was great. It was great. He did well. They took him off to surgery and they removed it. And he was a lucky man that day. It was a rural farm accident. In those days, we used to be able to go up to the roof of the trauma center and meet the helicopter and escort all the patients to the emergency room.
The coolest thing I've ever done or seen. I remember the first delivery I ever saw as a student, and I cried because it was overwhelming. Didn't know the patient at all, but cried right there with the family, was excited. And then we played with the placenta, which was rather cool. So we got to play with the placenta. But probably birth, just the miraculousness of birth, probably.
And one final piece of advice in each sentence.
My final piece of advice would be try to make a mental gratitude list of everything that you appreciate in your life. You're going to see a lot of patients that have tremendous adversity, whether it is adversity in physical condition, adversity in life. And I think if you make a gratitude list, you tend to realize how fortunate you are. My other piece of advice would be when the day has been too long and you're feeling emotionally and physically void of any energy, that you remember that there are thousands of nurses who have felt that way, and that there is a family, if you will, of nurses who are pulling with you and saying, yes, we know it can be tough and that you're not alone in that thought.
And one final piece of advice for us.
Okay, well, I'm going to leave you with the nurse's credo, okay? Never lie to a patient. Never let the doctor make you cry, and never pass up the chance to go to the bathroom.
Graduating students, brand new nurses.
Yeah.
So think about it, and then when you're ready, speak directly into the camera and just say it.
Okay. My greatest piece of advice for you would be to take care of the people that you're taking care of, your patients, their family members, exactly the way that you want to be treated and the way that you would want your family to be cared for. Just treat them like you want to be treated. You'll never go wrong.
One word, assessment. Right? If in doubt, look at your signs and symptoms, look at the patient, assess them, collect data. That data collection is going to help you come up, hopefully help you come up with what's going on. If not, it will at least give you enough information to give a physician to make the right decision. Assessment is an independent nursing action. You don't need anyone to tell you to assess your patient. So if you are in doubt about your patient conditions, do a good head-to-toe assessment and then call the physician with those findings so they can make that decision and keep the patient safe.
So the piece of advice that I would give any of you going off and starting your new job would be ask the question, will I get a mentor? Will I get someone that I can shadow? And it's so important that you have that period of time that you can work with someone who's experienced and see how things are done, how to use the equipment, because all equipment is different everywhere. And by having that person, it's going to give you a better, it's going to give you more of a relief, which is good because that's what you need. It's stressful as it is, and then you can slowly ease into the job. But always ask that question, who's going to be my preceptor and how long will my preceptorship be for? And that's my advice to you. Good luck.
Advice is to realize when you finish school, even if you're an LPN already, and becoming an RN or a new RN, that you're graduating as a new graduate nurse. So you're a beginning nurse. You're not expected to know everything. Just be safe and use the skills that you've learned in school. And when you don't know, you ask. And believe me, in 5 years, you'll be the expert nurse. So just remember, you're the beginning nurse, and you're not expected to be the expert nurse. Don't be afraid to say, I don't know, and get help. Don't try to fake it and lie or act like you know more than you know. And just make sure you ask for help and always work as a team.
One final piece of advice is to be an inspiration. Every day when you go to work, go to inspire someone. Have a positive attitude, be enthusiastic, and be the change that you want to see. Be the one that's willing to help. Be the one that's smiling down the hall. Be the one that's willing to be a team player, and you will change your environment. You will influence a unit to have a positive attitude and be a wonderful place to work, and you will change a patient's life. You can make that difference. And every time you walk into a patient's room, you have a choice. You will always influence their life. You have a choice whether or not you want it to be a positive influence or whether or not you want it to be negative. So I encourage you to always have it be a positive, and you will make a difference, and you will change lives. And remember that you can do it.
Awesome. Oh my god, I almost cried on that one.
The best advice that I can give you is to always be safe. Follow your instincts. Take care of patients as if they're your own family members, and never act without knowing.
Never forget what it's like to be a student, because there's always someone who knows more than you and always someone that knows less than you. And taking the opportunity to invest in another person is going to help you in all that you do as nursing.
All right, first and foremost, guys, I want to say congratulations. You've made it to graduation. It's been a long, tough road, but all of the long days and evenings spent in class, and clinicals, in the learning center, in the library, you guys have actually made it to this important day. So congratulations first and foremost. Just a couple words of advice, or some some advice essentially for you all, transitioning from being college students, now going into the actual nursing profession. I encourage you guys to always be lifelong learners. Don't ever stop learning. If it's going on to get your BSN and then eventually a master's, or if it's just getting certifications here and there, just continue learning, learning as much as you can about the field, growing and becoming a better nurse and the best nurse as possible. Second thing, I want to encourage you guys to try to find a mentor. Find somebody that you can bounce ideas off of. Find somebody that's been in the field for a few years. They can give you some advice. But somebody that you can talk to if you get frustrated, if you get stressed out, just have a crazy patient you don't know what to do with. Have somebody there that you can talk to and kind of, like I said, bounce ideas off of. But aside from that, again, I want to congratulate you guys on great efforts. Keep up the great work. I know that you guys are going to be great nurses one day, very soon, now that you've already graduated. So congratulations and take care.